This video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition.
Right now.
Okay.
And if you want to hit record when you're ready, I think the first thing I'm going to ask is, can you tell me who you are and a little bit about yourself?
We visit the University of Sheffield to meet with Gemma Arblaster, Orthoptist and Lecturer.
So my name is Gemma Arblaster. I'm an orthoptist and a lecturer in orthoptics. So my lecturing job is at the University of Sheffield, and I work as a clinical orthoptist at Sheffield Teaching Hospitals. So there's probably no such thing as an average week for me, but I tend to split my time between a small clinical part of my job 1 day a week and 4 days a week lecturing at the university.
What is an orthoptist?
An orthoptist is an allied health professional, and that's other examples of allied health professionals are physiotherapists or occupational therapists. So we're not doctors, but we're within the allied health profession group, and we're regulated by the HCPC, the Health and Care Professions Council. So what an orthoptist does is they measure vision and eye movements and how the eyes work together as a pair. So we're really interested in what each eye can see, but what the two eyes can see together, and whether they work together as a pair or not. And we're really interested in eye movement, so how much the eyes can move into different positions, but also if people have an eye movement problem, which means they either can't look a certain direction or maybe their eyes just don't stay still, like nystagmus, the eyes are constantly moving rather than staying still. So the types of patients an orthoptist would see include everything from a newborn baby right up to an elderly adult. We have lots of different clinical tests suitable for different ages and abilities of patient. So we can measure visual acuity, or what a person can see, but we can also assess the alignment of the eyes, how the eyes work together as a pair, and how the eyes move. And we can take various measurements of those different things. And there's different techniques for measuring different ages and abilities of patients. So we can assess whether there's a strabismus or a turn in the eye. And we could do that in a very young child as well as an older, very cooperative adult.
Why would a nystagmus patient visit an orthoptist?
Yeah, so patients with nystagmus can be referred to the eye clinic at any age, but an orthoptist is highly likely to be part of the eye clinic visit for a patient with nystagmus. Because we are the experts at measuring vision, particularly for children, it may be that if a child with nystagmus or has been referred with even just the possibility of nystagmus, an orthoptist is highly likely to be the first person that patient sees when they go to the eye clinic, because the orthoptist would assess their vision and assess and investigate their eye alignment and their eye movements and how their eyes work together as a pair or don't. And because we're interested in eye movement problems, nystagmus comes under that when somebody has a problem that they can't keep their eyes still when they're looking at different things. So nystagmus would absolutely be the interest of an orthoptist. An orthoptist wouldn't be the only person a patient with nystagmus would see. So on a practical level in the eye clinic, we work very closely with optometrists and also ophthalmologists, plus a whole range of other people that a patient with nystagmus might see. But they're probably the three most common. So an optometrist is the expert at measuring the refractive error of the eye. So is there an error that requires a lens to put the image in focus on the back of the eye? So is the person long-sighted or short-sighted, or do they have some astigmatism? Optometrists are also experts at examining the health of the back of the eye and the structures inside the eye. Whereas an ophthalmologist is somebody who's trained to be a doctor, so they've been to medical school and been through medical training, and then they've specialised in eyes. And if you have nystagmus and you're seeing an ophthalmologist, they're probably either somebody who's specialised in neuro-ophthalmology, so they're interested in how the eye and the brain all connect together, or they're a specialised paediatric ophthalmologist who are experts at assessing children's eyes, or maybe even they are interested in the eye movement and the strabismus side of things. So it might be that you have nystagmus, but you have strabismus as well, and you're seeing an ophthalmologist who's specialised in strabismus, but they also understand your nystagmus.
What are you looking at in a nystagmus patient?
In a clinical capacity, how an orthoptist would work with somebody who's got nystagmus or a family of a child who's got nystagmus, it's about spending time with them to first of all ask them questions and find out what's happening, how that nystagmus is affecting them, and to hear about what questions they have and trying to answer those questions as simply but as comprehensively as possible. It's also about investigating the patient in front of you, so as accurately as possible, measuring what they can see, what they can't see, whether there are any visual difficulties or symptoms that they're having. So that often involves measuring vision, so what they can read on a letter chart, but it also involves assessing how their eyes work together as a pair or not, how well they can use their eyes together and judge depth or not. It also involves investigating their head position. Or do they have a head posture? Do they use their convergence to kind of dampen their nystagmus? There are lots of different aspects of nystagmus that it's important to build up that clinical picture of what's happening or not happening to that individual, as well as looking at the nystagmus itself and observing their eye movements.
How might an orthoptist test a child's vision?
An orthoptist would measure vision or visual acuity, and we have lots of different clinical tests that are suitable for children up to cooperative adults and everybody in between. So an older adult who's very cooperative would probably be able to read out letters on a standard vision chart, but for children or people who can't read out letters, we might have something that's more picture-based. So this is an example of a clinical test that would be more suitable for a child. They might be asked to read out the pictures, and a little bit like letters on a chart, the pictures do get smaller. Some of the vision charts for children have just one picture on its own in the middle, yet others are deliberately more complicated where the pictures are together with a crowding box around. We're trying to make that vision test as accurate as possible. So there's lots of research that's gone into making children's eye testing as accurate as possible, even if they're able to just name a picture, say a sound, or point to a picture on a matching card.
What are prisms?
So we use prisms in the eye clinic, first of all, to measure eye alignment. We also use them to assess the movements and the fusional ability of the eye, so whether patients can move their eyes to overcome prisms. And we're also interested in whether we can use prisms as a management option to help a person with nystagmus or not. So the version that you have in the eye clinic are these kind of glass versions. So it looks like a piece of, like a window that's held in front of the eye. They start very large and they go to very small. So they're in different sizes. And we would use those in the eye clinic to help investigate what's happening to the nystagmus when we kind of manipulate the eye position with a prism. They can also be used as a management option for some patients with nystagmus. A certain amount of prism can be built into a glasses lens, so if it's a smaller amount of prism, And the Prisms also come in a temporary version that we can trial. So they're not often used in this format as a permanent solution, but they are essentially lots of prisms in a layer of plastic that can be attached to somebody's glasses as a temporary measure or a trial to see if prisms would be helpful long term.
How would you assess 3D vision?
An orthoptist would assess how the eyes work together as a pair, and there are different ways our eyes can do that. So we're interested in whether the images each eye sees of the world come together into a binocular image. So we call it a binocular single vision. We're using prisms to measure how well the eyes can maintain that binocular image even when we make them move around. And then we're also assessing 3D vision or depth vision. And we have a range of different clinical tests to assess 3D vision. This is just one of them. And it involves the patient being asked to look at an image and identify which of the four squares has got a circle shape sticking out of it. And we can use this in very young children as well as older adults. And we can manipulate the amount of depth that the patient sees by using different plates that are thicker or thinner, and also by adjusting how far away from the patient we are. So we can measure their 3D vision even if it's very gross and not as good, or we can measure it also if they've got excellent 3D vision. So we can measure it with a numerical value. And we can do that in very young children, as well as older adults and people with kind of limited cooperation. So it's based on the thickness of the plate and also how far away it is from the patient.
What common advice could orthoptists give for nystagmus patients?
Common advice for people with nystagmus is first of all to consider the optical correction and whether optical correction by glasses or contact lenses is going to make a difference for them and their vision, and making sure that's fitting properly and also appropriate for if they also use head posture or convergence. So those are two other important aspects. For some people with nystagmus, particularly the infantile type, it might dampen on convergence. So as they bring their eyes in towards their nose, the nystagmus becomes quieter. So that's the reason some people with infantile nystagmus hold things very close, and that's a good thing. They're doing that to dampen the nystagmus or make it quieter and make their vision better. So understanding what that's for and making sure that families understand that children shouldn't be told to hold things far away would be an important part of the understanding of the nystagmus and what that convergence is doing. That also links in with head postures and whether a patient with nystagmus holds their head in a preferred position. Again, it's typically to make the nystagmus quieter or dampen down to maximise vision. So assessing that head posture, measuring it, and measuring the difference it makes to their vision are important parts of an orthoptic assessment, so that advice and guidance can be given on that head posture and how to utilise that to best effect, or how to position a child in the classroom so that they can use that head posture more comfortably. They're all really important parts of advice for a patient with nystagmus.
What do you do with all the measurements and assessments?
So there are lots of individual pieces of clinical information that come together to help an orthoptist and an ophthalmologist and the team of people help the patient with nystagmus or their families, and understanding their individual aspects is really important. The support is often in the form of advice and information about nystagmus generally, whether glasses or contact lenses are an appropriate part of their management, so that optical correction is really important. The orthoptic side of it is whether there's also strabismus or eye misalignment issues that are factoring into the nystagmus, how their head posture and convergence affects the nystagmus, because that can have a really big impact on an individual when they need to hold their head in a certain position or make their eyes move to a certain place to dampen the nystagmus. There are, for some people, in terms of treatment or management of their nystagmus, that might be a surgical option that they would discuss with an ophthalmologist, but there are other non-surgical things that can be tried. In addition to the optical side, looking at the head posture, looking at whether convergence is a factor, but for some patients it may be that prisms are an appropriate thing for them to try, and in even some cases we might try some orthoptic exercises if that was appropriate. But all of those things are decided on a really individual level. The other way that orthoptists can support patients with nystagmus is providing them really clear information about what nystagmus is, but where they can get support, whether that's from the hospital setting or the wider support network. And for some people with nystagmus, it may be appropriate for them to be referred to a low vision clinic. So whether additional things can support their vision or support them in education, support them in work. So many orthoptists also specialise in low vision, where they can look at whether there's any low vision aids or strategies that would be helpful for a patient with nystagmus in addition.
What are the benefits of being a clinician and lecturer?
I choose to keep a clinical role, so I don't have one job. I choose to have two separate jobs, and my clinical job is quite important to me. I feel like I'm a clinician at heart and I enjoy spending time with patients and helping them. So I'm very fortunate to be able to combine both clinical and my academic role. I feel that being a lecturer in orthoptics makes me a better clinician, but I also feel that being a clinician makes me a better lecturer. So for patients with nystagmus, what that means is they're seeing somebody who's got that clinical expertise, but also that up-to-date knowledge of the condition. They're not only up to date, but they're teaching others how to investigate nystagmus and assess it, and also help patients with nystagmus. And then that feeds into the research as well, because we want to make sure that our research that we're planning is up to date with what's happening clinically, but also happening in terms of the literature evidence. What are other people doing in the field?
Tell us about your research in nystagmus.
Yeah, so we've got to make sure that our research is based on what is important to patients and important to clinicians. And part of identifying the right areas to research are making sure that other people aren't doing the same thing. So it's having an awareness of where the gaps are, but that assessing that need or where the unmet need is also very important. Research feeds into that, but also what's important to patients and what they feel are the most important questions to answer. They're the things that feed into developing those research ideas, those proposals and those grant applications, and then ultimately doing the project as well.
What is the Nystagmus Information Pack?
The Nystagmus Information Pack came out of a Nystagmus Network Open Day. We managed to secure some funding to go to a Nystagmus Network Open Day. It was in Newcastle, I believe, and we took with us a large group of undergraduate orthoptic students, and they had various tasks during the day that involved mixing with the audience at the open day and finding out patient perspectives on various things. And it was quite apparent that patients were, or people at the open day, families and people with nystagmus were really seeking information and were reporting that they weren't gathering or able to gather information to walk out of the door with from a clinical appointment. So after that open day, one of the things we did was find out from the orthoptic profession how many people actually had nystagmus information to give to patients, where they were getting it from, and did they have examples of really good clinical practice that others could adopt. So what came out of that information was the development of the Nystagmus information pack. So the University of Sheffield has supported that with funding in a couple of different aspects. A few different students have worked on that. Firstly, to create it and disseminate it and share it, but then also to evaluate it. So constantly evaluating the content and updating it is something that we're keen to do, because whilst there are other sources of nystagmus information, sometimes patients or families are looking for different levels of detail. Sometimes they want just a very brief one-page leaflet, but there are times where patients and their families are looking for a little bit more in depth. The reason we chose to create it in different chapters is it's actually quite difficult to create one resource that fits everybody with nystagmus, because nystagmus is different for different people and they might have nystagmus for different reasons. So we created it almost in chapters so that people can download or use the sections that are most relevant to them. But updating the content of the Nystagmus information pack is definitely something we're always working on. Yeah, so we know it is being used, we know it is being searched for, and patients may come to a clinical appointment with that, and they might say, this is what I've found. Or sometimes we're actually directing patients to it and saying, if you just search for nystagmus information, this is where you'll arrive at, and this is how you use it. We've had contact internationally to say that they don't have anything like that in their own country. Can they use it? And the answer is yes. It's available for everybody, it's free, and it should be open to all. So our feedback, and when we've kind of surveyed and evaluated the pack, is that it's very useful for clinicians to be able to have a resource that's comprehensive to signpost people to.
Brilliant. That's really, really good.
How does Nystagmus Network support researchers?
Charities like Nystagmus Network sometimes reach out to either clinicians or researchers who are interested in the topic to make connections for the benefit of patients. And I think it's firstly information. So people who are going to Nystagmus Network often want information and support. And that support can be from a combination of different people. So academics and clinicians with an interest in nystagmus would support Nystagmus Network by contributing information, resources, guest lectures, even just talks at events, so that people who want that academic or clinical information from the horse's mouth, from an expert, can get that, but the connection is through Nystagmus Network. So they really bring together people who are interested in the topic, people who are experts by clinical or research experience, or experts because they've got that lived experience of having nystagmus. They bring everyone together to have those conversations and to learn from each other.
Brilliant. And you are also attending the symposiums and the other things that Nystagmus Network themselves bring together, like the research days and conversations between clinicians there. Maybe you could speak a little bit about that.
Yeah, so part of the Nystagmus Network events or suite of activities that they offer, some of those involve patients or people with nystagmus, so I would attend those or participate in those where I can, but there's also things that happen behind the scenes that maybe people with nystagmus don't see. So that involves NUC, so that's a research group in the UK bringing together researchers who are interested in nystagmus to talk about how they can work together, plan research together. We also talk about the research we're all doing individually so that we can benefit from each other's expertise and make sure that our research either comes together where it's appropriate and we collaborate, or we find out what others are doing so that we make sure our research doesn't overlap if it doesn't need to. We can each go in a slightly different direction. So that Nystagmus UK research group is one way that Nystagmus Network is supporting researchers in the community. And the other way is in their International Research Symposium. They're kind of taking that wider. It's almost like a mini research conference held online so that people who are all around the world who are interested in Nystagmus research can again come together, hear about what each other are doing, collaborate where is appropriate, but just learn from each other. So the last International Research Symposium involved researchers working on animal research, human research, everything from paediatric, from children, right up to adults, lots of different types of nystagmus. And I think that research symposium covered everything from quality of life, what's important to patients, to measures of vision and how we can best measure nystagmus, but also on a molecular and a cellular level, what's happening to further our understanding of nystagmus in different clinical conditions.
What support have we provided to Sheffield?
I've been fortunate to be awarded amounts of money from Nystagmus Network over the years. Their research support and their funding support for research has contributed to the University of Sheffield purchasing an eye tracker. So that's currently used to teach students more about measuring eye movements and nystagmus in more detail. Nystagmus Network has also more recently funded a project that is a collaboration between myself and Dr Sonia Tor here at the University of Sheffield. It's all about accommodation, and what that means in an eye sense is focusing and how our eyes focus on different things. So we're really interested in measuring focusing in nystagmus to investigate that in more detail. We've got some very simple clinical equipment, and we've also got some very complicated research equipment. The project will use all of the different measures of accommodation that we've got to work out what is the best way to measure focusing or accommodation in people with nystagmus. We want that information to be useful clinically, but we also want that information to be useful for research. We'd really like to plan future research looking at focusing in nystagmus and how that compares to focusing in people without nystagmus. There are lots of theories out there. We really want to understand more about the dampening of nystagmus with different head postures and convergence. And there are some theories out there about how accommodation or focusing ability might drive some of that change. So we're really excited to be awarded the research funding, and we will be looking to recruit participants with infantile nystagmus, with albinism and nystagmus, and also controls without nystagmus in younger people, to make sure that we are measuring accommodation or focusing ability in as much detail in as many different ways as we can. And the patient and involvement in that will come slightly later, because we'll be presenting our findings to patients and people with nystagmus to then talk to them afterwards about what's going to be really important to them. So we can use the research evidence plus the patient involvement and their opinions to guide clinical guidelines in how we should measure accommodation or focusing ability in the eye clinic, but also guide our future research and how that's going to look in the future. The equipment that will be used in that research grant is called the Orthoptics. and it's the PlusOptics Power Ref3.
Wow.
It's a piece of equipment that it takes very detailed measurements of how much the eye is focusing, the power of the eye, whilst it's looking at different things. So we can present different stimuli, we can adjust the distance of the target, and we can manipulate lots of different things about the target to investigate accommodation or focusing ability in lots of detail. The PlusOptics Power Ref3 involves testing patients one at a time, and they would sit with their chin on a rest, and they would look at a target presented in the piece of kit. There's a very sophisticated camera taking measurements of the focusing of the eyes whilst the patient is being asked to look at different things. So the stimuli are presented on an iPad, which is within a very long box, and the iPad would move to different distances, and we would manipulate different stimuli shown on the iPad. And so the person that we've invited to take part in the study would be looking at things on a screen that moves around, but during these different visual tasks, lots of measurements are being taken of the eye and how much it's focusing. We're very interested to know how well that works in people with nystagmus and to compare the results to some of our more standard clinical measures of how the eyes focus. So the study will involve lots of different measurements of accommodation in different ways.
The Nystagmus Network would like to thank Dr Gemma Arblaster and the University of Sheffield. We've been funding nystagmus research since the 1990s. We've seen huge advances in diagnostics, and we continue to strive towards treatments, prevention and cure. Our work goes beyond research. We have online events, face-to-face events, provide volunteers, and documents that are accessible for all. Connect with the Nystagmus Network through our website at www.nystagmusnetwork.org or through email with info@nystagmusnetwork.org. Alternatively, you can call us on our phone line at 01427 718 093, or you can contact us through social media.